So in this session number 2 today, we will be covering organon of medicine, and here analysis, evaluation and totality of symptoms. This will be covered under 4 heads, and as you can see, these 4 heads are analysis of mental signs and symptoms. Remember, all we have studied as students is applicable. In addition, there are certain points which are added here, and that is what I am trying to do in half an hour, because this topic cannot be covered in half an hour if you go into all the details. These are additional things towards which the attention needs to be drawn, and that is analysis of mental signs and symptoms, evaluation and popular ranking. What we understand by popular ranking of symptoms or evaluation of symptoms. Then Hahnemann's ICOTS, the concept which we discussed in our first lecture, and few case examples which in this particular case have not been taken from my practice, have been taken from Dr. SPD's book, because they are more illustrative cases. Now, simplified analysis of mental signs and symptoms. Here remember one thing, that under these heads, these are all disorders, that is symptoms, signs and symptoms are seen in the light of a disorder, in the light of a disease, because order if you see or health if you see, then health there are number of models, no? Because health is a concept, health is an imaginary thing, they say, you may argue, whereas sickness is an abstract, not an abstract thing but a concrete thing and a reality, because you can see the sickness but you cannot see health. You cannot see happiness, but you can see cure. You may argue as a philosopher. So you have always to see order versus disorder. So whatever is disorder, that is important. Whatever is order, they don't come to us as physician. So motor behavior, one thing. Then thought, language and communication. The symptoms have to be classified or analyzed in this particular manner. And that is speech symptoms, form of thought, then content of thought. In content of thought, delusions come, because thinking is delusion is covered under thinking. Then next is perception. Under perception, all illusions, hallucinations and abnormal experience of self and environment, they all come. Now you know what is illusion? Illusion is that something is not there, but you feel about it, abhas you may call it. Then hallucination is that something is there but you are misconstruing it, that is false, and that is hallucination means they pertain to all 5 senses, that is touch, vision, hearing, all the 5 special senses, they pertain to that. If there is nothing but I am seeing something, there is no visual stimulus is there, but I am seeing something, so that is visual hallucination, auditory hallucination. So they are perceptions, they are disorders of perception. Then under emotions, illusions means see, illusions are no. Abhas means wrong perception. A rat is there, but I am seeing a rat when it is not there. So there is a difference between object has to be present, but it is misunderstood. There is an object. There is a there is a cord, रस्सी है, लेकिन रस्सी को आप समझ रहे सांप, गलत समझ रहे हैं. Whereas here there is no cord, but you are thinking that there is a snake. You are seeing a snake without anything being there. So yes, that is hallucination and that is illusion. So for us,
wrong perception.
Illusion is wrong perception, and here it is perception from nowhere. From nowhere. Now under emotions, positive and negative emotions, and that we have already seen that. I'll again emphasize that. Then affect and mood, they are covered under this. Now these positive emotions are love, hope, confidence, faith and creativity. They are to be encouraged, and they all contribute to health and well-being. Then under negative emotions, fear, hate, anger, greed and jealousy, they are all injurious to health. So it's the job of a physician to focus and to explain on that particular thing. So here we have seen emotions. Then primary mental functions. What are primary mental functions? Consciousness, attention, orientation and memory. Under mental state examination, which we studied last time, we have already covered these features. That how, what are the types of memories? Immediate memory, late memory, so this recent memory. So all these type of examination is covered, but then this is all the mental symptoms have to be classified or analyzed in their proper perspective. Simply taking a symptom and not classifying it, not analyzing it, is not as good as doing that work ourselves, because it will help us in evaluation. Now let us see about evaluation. Now evaluation, it differs from physician to physician. Every physician has got different criteria to do this evaluation. You read Kent, you read Bonnie-Hassan, you read different authors, current authors or past authors. They will tell you different things, though they will be concluding from what Hahnemann has said. Number two, the modern concepts. So they are to be taken into consideration. As a result, it is said that this is an art. It is not a science, because there is no rule of thumb present. It is an art. And what is that art? Art is a matter of performance. When you say that I have based my prescription on the basis of this, prescribed and got the result. So when I get the result, then there is a positive reinforcement in my mind, and that becomes accentuated. So that is an art. Now you cannot make it routine for everybody, but still there have to be some criteria, no? It cannot be whims and fancies. There is a difference between an art and a matter of whims and fancies. So for that, a hexagon of common parameters, 6 features have been enlisted here, on the basis of which we have been making evaluation. One is nature of complaints. That is particularly the locations and sensations, nature of complaints. What is the type of complaint? What is the nature of complaint? On the basis of that also we can do an evaluation. That is when it identifies, when it becomes a typical type. Second is peculiar, queer, rare and strange symptoms, PQRS symptoms. That is aphorism 153, in which Hahnemann has said that it is most important to catch the peculiarity of the case, how it is different from others, and prescribe on the basis of that. So that is a feature. Modalities, modalities is also a very important feature, and so is concomitant. Remember, in concomitants, everything which attends or is associated is not a concomitant. But there are certain unreasonable attendants. That is, there is a headache, and with headache there is nausea and vomiting. It is there because there is bilious headache, because there is a disturbance of digestion associated. So then that is not a concomitant. But if nausea without any digestive problem is associated with particular headache, then that becomes a concomitant symptom. So wherever an attending feature is not explaining, is not reasonably present, otherwise what will happen? You will take 4 symptoms. That is, one is digestive symptom you are taking, one symptom is of say upper passage, or rather upper gastric, second is lower gastric, and third is about your say bowel or rectum. So you will say that each of them becomes a concomitant of the other. No, they are the same, one single thing and its manifestations or ramifications. So concomitant is not a manifestation or a ramification. It is an unreasonable attendant. We can by practice understand that. Then miasm is another point on the basis of which prescribing has been made, but lot of confusion has been drawn into this, and we have talked about it that basically it has to do with sura. Then majority of the symptoms as per repertory. That means you select the major symptoms, and the major symptoms you put to repertorization, and on the basis of repertorization of main symptoms or key symptoms you come to evaluation. So this is a common parameter hexagon, and in this next question comes about ranking, that how do you rank, what is most important. They say the most important, Kant says, is will, and because in will the symptom of suicide is there, and when one has got no love of life, then that becomes the most important symptom. It is not correct in the knowledge or light of psychiatry, because this suicide, desire to suicide, is a common symptom found in depression, and depression is a mood disorder. It is not a cognitive disorder. Cognitive is thinking. So cognitive disorders, that is cognition is based higher. So over there, the symptom of suicide is not related to cognition. Then what is more important? So ultimately, we only noted that mind is most important. In mind, we have to analyze by the knowledge of psychiatry or by the knowledge of the symptomatology of the patient. And next will be sleep and dreams. Next again, modalities in mind. That is, how do you feel? Mentality. How do you feel? Sometimes what happens, patient says that I am very good in clear fine weather. Now clear fine weather, he is good, he is fine mentally. I feel mentally comfortable. So that is a modality of mind. Then generalities. Generalities are to be given more importance than particular symptoms. Remember, in the light of what we are discussing of psychiatry, most important two features are added. One is delusions and hallucinations. That is psychotic features. Delusion hallucination एक नहीं है. Delusion. ना ना, illusion अलग. Illusion is different. Delusion is false belief. False belief, delusion of grandeur. That is, as if I am a king, as if I am Arvind Kejriwal. So that type of feeling, that is delusion. Delusion is false belief, no, and hallucinations. So these are basically psychotic features, because they have got a tendency to disturb the personality and land into a mental sickness, and but not necessarily that it should be put a stamp of psychiatry on that patient. You can give a simple homeopathic medicine and remove that particular delusion or hallucination and make the patient perfectly normal, or like that the symptomatology, wonderful response can occur. So that is psychotic features is most important. And second is personality disorders. For example, four of the common ones we have listed here: paranoid, histrionic, narcissistic, and OCD. There are others, but they are not that common. That is, you don't find those patients so common. But these four patients you will find in your day-to-day clinic having paranoid features, suspicious features, then histrionic features, that is dramatic type of person, a personality which is putting on very good colored dress, sari, blouse, etc., and saying, "Doctor, I am very sick." So that they are the people, on the basis of that you cannot just simply prescribe a medicine on that basis alone, but note it as a personality and go for group of remedies. Narcissistic, that is the persons who are basically want to be focus of attention, and that is personality we have studied disorder. And OCD, obsessive features. So these symptoms or these two features you have to watch for at the time of evaluation, in addition to what all you have studied as evaluation of symptoms. I am to add these two things. Is it clear now? Now here the rubrics. Remember, this ranking or evaluation is related to rubrics also. Just we discussed that in Hering's guiding symptoms, this 4 marks had been given as top rank with two hash type sign. What is it called? Then this type of sign that is double bold. In book it is double bold. In computer this sign is written. So these are the symptoms which are repeatedly verified. So that particular drug becomes a candidate for us to be used in this condition. And then 3 marks, that is symptoms verified by cures, 2 marks symptoms more frequently confirmed, and 1 mark is occasionally confirmed symptoms. Here you are ultimately linking the symptomatology with our mainstream of knowledge of homeopathic drugs as symptomatology, because what you are finally required is to match them. Then that is popular ranking and evaluation. Then we go to Hahnemannian ICOTS. Under Hahnemannian ICOTS, it is we have coined this word. I means individualistic, CO means cause oriented, and TS means totality of symptoms. So there are 3 things. One is there has to be individualization. The case must be made in such a way that its identity should be established. It should not be any one of those conditions. Second is cause. Now cause is not only miasmatic. Cause is ailments from. In mind you come across features ailments from. Now that cause basically is again a concept. Cause is a concept, and cause is proved either scientifically or by anamnesis. Now remember what is anamnesis? Anamnesis is one thing ahead of diagnosis. Diagnosis. Agnosis means ignorance. If you resolve the ignorance whether this is this or this or this is ignorance. It can be this, it can be this, it can be this. You resolve that. No, it is this. It is typhoid. It is not malaria. It is not this condition. It is not this condition. So agnosis is resolved and diagnosis is made. Then there is one thing which is called anamnesis. Now what is anamnesis? Anamnesis is in a particular chronic case or in a condition, difficult condition, evolution of that condition, how the condition evolved. That is the beginning. So it has to do with history. History means what? Temporal contiguity. Temporal means timing. Contiguity means one after another. So if this took place in 1999, this took place in 2002, then what took place in 2002 cannot be a cause of what took place in 1999, because cause must have happened earlier. So that is how we relate in patients as concepts. In our family, in qualified and unqualified, everybody, we try to understand things in the history. That is, which was the event which took place earlier. If I am sick from 1997, then I must have to find the cause of it. What happened in 1997? You will say scientifically, oh no, it was a particular infection of this bacteria. So that is a medical or a scientific cause, you can say. But in anamnesis, that will not explain. You have to be very sure that what was the thing which happened earlier. And temporal contiguity or history or anamnesis is very important for homeopath. That is why history taking is important, because a patient does not remember. He is to be taken down under the memory lane. You have to take him back and back and back, so that remind him and try to relate this. So cause oriented, that is event which took place earlier, and totality of symptoms. Under this, let us see. Even Hahnemann in Aphorism 88, we have also seen this earlier, says inquire into emotion. It is mind importance, temper, state of mind, frame of mind, and mental power or memory of the patient. These things are to be examined. So Hahnemann also emphasized on these particular things, because here the individualization of the patient can be placed. Then let us see about those cause. Modern causative factors. Stress is the commonest cause today in the particular time we are living. Freud had said that anxiety is the cause that mankind has paid for civilization. When we were all uncivilized, we were not even putting leaves on private parts and roaming around here and there. We were very happy. Yes. Basic. We were very happy because our problems were different. Our problems were different. But this anxiety and this thing was not there. So this anxiety is the cost which we have paid for civilization. But what will you talk about a person who has overpaid? We have not only paid, but we have overpaid for that civilization, and that the result is stress. Stress today, hence Sally has explained. Cancer. Yes, even cancer can be caused by stress. Now, stress common factors: insult, punishment, stressful life events, situations, occupational, educational, pecuniary, that is financial problems, family illness of the family members, separation by death or divorce of life partner, supposed to be one of the maximum cause of this stress. They call it life change units, LCU. Life change units are the events which take place in the life of the patient and which affect the patient. So at the top of that list is the death of or life partner or even divorce. Then fear or phobia of cancer. Today's disease is this cancer, and cancer's fear or phobia, that is the stress. So these factors have to be covered. And where from? From the picture of our drugs in the metabolism. Those drugs should have that potential to similar or to make a match a picture of these particular conditions from the symptomatology. Repertory helps us in that. Rubrics of mind, ailments from, these are all taken from radar: alcoholism, anger, anticipation, anxiety, bad news, business failure, cares, worries, death of loved ones, disappointment, emotions, excitement, then fear, fright, grief, indignation, jealousy, joy, love, mental exertion, mental shock, from mortification, sexual excesses, unhappiness, etc. Mortification means something with anger, suppressed anger with suppression. So that is fear, anger, suppression. In short, all these things you can see from the repertory, and from there, as I have told you, that select the drugs whose mentality is known, and that is in Herring's guiding symptoms. Mental picture has to be more than at least half a page, and there have to be some single bold and double bold symptoms. So if you make such a list, I have given you that list. About 60 remedies are covered in that. So try to select in that. If there are remedies out of that in a bold, you can always remember some of them, but basically focus on them. Finally, few case examples. Now under these case examples, we have Dr. S.P. Day's cases. First is the case of psoriasis, where the patient had psoriasis, joints were affected, and because of that psoriatic eruptions, the flexion of the joints had taken place. Joints were flexed, and so much so that slightest extension was leading to bleeding, and the patient was bedridden. In such a bad state the patient was. His personality was love to play sitar, attractive appearance, and great fear of dogs. On the basis of that, Sir gave tuberculum, which was followed by Staphylococcus aureus, and there was wonderful response in that patient. So here, where is the skin? Because in the book of psychiatry it is written, in the book of dermatology it is written that skin is the index of mind. If you are happy, the skin is glowing. If you are unhappy, the skin itself the luster shows. If there is stress, it speaks through skin. So here tuberculinum is prescribed on this basis. Then cancer eye, red vermilion tongue, disproportionate pulse on the basis of this pyrogen followed by a nitric acid. These cases you can read in Dr. S.P. Day's book on essentials of principles and practice of homeopathy. In that these cases and other cases are there. So remember, cancer of eye. Now naturally cancer of eye, the details in that do not reveal that the patient was cured. But the result of cancer, that is even if euthanasia is given, even if lot of relief is given to that patient, then it cannot be given by palliative prescription. It can be given by similimum. And similimum is to be selected not on the basis of the particular symptoms alone, but on the symptoms which are from the generalities. So individualization, disproportionate pulse, and red vermilion tongue is pyrogen, red vermilion lips is sulfur. Then bronchial asthma. In bronchial asthma, silesia was indicated, but even after giving silesia, there was no result. So here pertussin was given because there was history of whooping cough. Now, on the basis of history of whooping cough and bronchial asthma beginning after whooping cough, this silesia gave wonderful result, resulted in cure. Rheumatism medicines, though indicated no relief. Soranum was given on the basis of hunger on waking at night. Prominent symptom. The patient would get up in the night and will go and eat. That is a regular feature. That is rheumatism did respond to soranum on the basis of this symptom. Last case here I have chosen is of renal stone. Lycopodium seemed apparently indicated, but Madorinum work expelled 3 pieces of considerable sized stones, must be about 1 centimeter or so, in a month. And thirst on waking at night was the prominent symptom. In Madorinum, it's a symptom written in bold. Thirst on waking in night. Now you will see repertory and see a very big rubric and say, sir, there are 150 remedies for thirst at night. But there is a difference. Whether they are Roman, they are italics, or they are bold. That is to be seen, and whether they belong to a remedy which has got that particular potential. So this example, 5 examples of evaluation I have chosen for this purpose, and that completes my this presentation on organon medicine. If there are any questions, you can submit them. We can